you. All right, we are now at our opportunity for public comment. You are allowed 5 minutes. We'll permit 30 total.
Good evening. My name is Chad Bishop and I live at 7405 South Valencia Drive here in Sioux Falls. This is in the spirit of accountability and fixing important things. Imagine if, back in January of 2021, one of the largest regional healthcare providers in the Midwest had issued a press release about the preprint containing the preliminary results of their SURVIVE study, seroprevalence under repeated viral immunity examination, which showed that over 55% of healthcare workers had already developed antibodies to COVID-19 by the end of 2020. This information could have been a game changer, not just for our region, but for public health policy nationwide. Perhaps it would have prevented my father's vaccine injury as diagnosed and purportedly reported by his primary care physician. If you remember how quickly COVID-19 was spreading at the time, it begs the question as to what was the seropositivity rate in November of 2021, 10 months later. The findings from this study were eventually published in a reputable journal, Antimicrobial Stewardship and Healthcare Epidemiology, confirming that the quality of the data was not in question. The problem lies in the timing of its release. The study also revealed that a significant number of those who were antibody positive had experienced asymptomatic or subclinical infections, meaning they had never reported symptoms or received a positive PCR test. This insight could have dramatically reshaped our understanding of the virus spread and the true extent of immunity within the population. Had these findings been shared as a preprint, a version of the study released before undergoing formal peer review, the data would have been available much earlier, giving scientists, policymakers, and public health officials across the country the chance to incorporate this critical information into their decisions. A preprint allows the rapid dissemination of important research, providing an opportunity for immediate feedback from the scientific community and enabling quicker, more informed decisions. Instead, from what can be publicly discerned, the study wasn't submitted for publication until November of 2021, after vaccine mandates had been implemented across the country and locally. The study was accepted by the journal in December of 2021, but wasn't published until February of 2022. If this data had been made public earlier, it could have prompted a reassessment to the public health strategies we were following, strategies that continue to enforce lockdowns and vaccine mandates despite growing natural immunity. Two words you couldn't say at the time without receiving ridicule because of government-sponsored propaganda and misinformation. Unfortunately, decisions were made based on outdated or incomplete information and the public was left in the dark. This was during what was described as a once-in-a-century pandemic, where the timely release of information was more critical than ever. Moreover, it's important to note that the published data did not include an analysis of the durability or efficacy of infection-induced immunity, key research areas announced in the original press release dated July 23rd of 2020. This omission leaves us with an incomplete picture of the role and acknowledgement of natural immunity could have played in shaping our public health response. So my question is, where was the fourth estate? Where were the journalists whose role it is to hold power accountable and inform the public? It's hard to follow the science if it's not published in a timely manner, even more so if the public and policymakers are not made aware of it. Lastly, a question. Were members of either of these bodies or members of your respective governments made aware of the preliminary results prior to February of 2022? Thank you.
Anybody else for public comment?